I'm Dr. Tim Steflik with Coastal Integrative Healthcare. Today I'm going to share some amazing information with you regarding research around regenerative medicine and stem cell therapy. In the last 10 years, 20 years, there's been an extensive amount of new research being conducted on stem cells. Research on stem cell therapy goes back over 100 years and was published in the American Medical Association Journal. Most recently, there's been studies that have covered a variety of conditions, a variety of topics. You can find a list of these research articles and research studies that have been done if you go to clinicaltrials.gov. If you type in stem cells, you're going to find over 5,000 research projects, studies that are currently being conducted or have been conducted. And the amazing thing about these studies is that the majority of them are not for orthopedic conditions, meaning the majority of them are not for knee pain, back pain, shoulder pain. Most of them are for conditions such as Parkinson's disease, other neurological conditions like autism, or we've seen multiple sclerosis, a lot of autoimmune conditions like rheumatoid arthritis. There's a lot of different conditions out there that have been researched, diabetes. The list goes on with all the different types of research out there. Duke University did one of the biggest and most comprehensive studies to date with stem cells and autism. They did a study that was published just a couple years ago showing that kids who had autism had huge improvements in their condition after being treated with umbilical cord stem cells. Now, these children were kids, some of them who wouldn't even hug their own parents. After the treatment, they were able to hug their own parents. And I don't know, as a parent with 4 kids myself, if you could put a price on that. It's absolutely amazing what is being achieved in the medical frontiers and the research with stem cells. So what has Duke University done? They had to make the study 10 times bigger to definitively prove or to show that there was some actual benefit and it wasn't just a coincidence. Of course, it wasn't a coincidence. One of the other large studies that was done by Mayo Clinic. And Mayo Clinic did a study on knees in particular. They did an injection of stem cells in the knees, x-rayed the patients, and x-rayed them over a year later. What they saw was an increase in space between the femur and the tibia, which means an increase in space where the cartilage and meniscus sit in the body. What this tells us is that those tissues had actually regenerated and created more space in that joint, more cushion. There's a lot of other examples of research that's currently being conducted on stem cells. News articles coming out every day about helping it with HIV and helping with cancer and pretty much any condition that you can think of. So regenerative medicine is the future. And the good news is that it's here now and it's available. If you found this interesting or have any questions, let us know. Please share or write a comment and we'll be in touch. Thanks.